Hi, I am Jessica Collette, and the purpose of this video today is to inform my audience about the importance of nursing and what they add to the medical community. From patient advocacy to skilled individualized care, there are many reasons why nursing remains the most trusted profession every year. Florence Nightingale was the mother of nursing. Florence was named after her city of birth, Florence, Italy, in 1820. Before the 1850s, nursing was not a decent job. But Florence made a groundbreaking change and revolutionized nursing as the profession it is today. The Crimean War amassed many casualties, not only by warfare, but by disease and unsanitary conditions. In September of 1854, the English had claimed victory to Russia in Alma, and despite the victory, the English suffered massive casualties, and medical camps were overloaded with soldiers in small, dirty environments, with only a few overworked doctors. Florence arrived to the military camp with a team of 38 nurses. She created a clean environment for the injured soldiers and decreased the mortality rate from 60% to 2.2%. She provided as much care for the soldiers as she could, and every night she took her lamp to the soldiers' camp to care for them. Her work was recognized by royal officials at the time, such as Queen Victoria of England. She helped in creating the Royal Institute of Research, and in 1860 established her Nightingale Nursing School, the first nursing school in the world, and it would change nursing to the reputable position it is known as today. One reason to listen to my speech is because nursing has been voted year after year as the most trusted profession, and it is important to understand nurses' vital role in the medical process and what they can do for you. Once again, from patient advocacy to skilled individualized care, there are many reasons why nursing remains the most trusted profession every year. So why should you listen to me? The first reason is because I have dreamed about becoming a nurse since I was a little girl. Therefore, I have looked into the topic for years. Second reason is because I am a licensed practical nurse and I have been providing care to patients for years now. I'm going to start by reviewing the main points. First, I'm going to discuss nursing itself. Second, I will discuss what nurses do for patients on a daily basis. And finally, I'm going to discuss why nursing is so important and why it is a vital part of the medical community. Firstly, while caring for those who are sick, dying, and disabled is the primary overall goal, a lot of aspects are included in the nursing process, such as nurses provide patients with life-saving medications. These medications save patients' lives every day. Next, nurses monitor patients' blood pressure in order to give the proper medication to keep levels from shifting to dangerous amounts. Nurses also closely monitor a patient's pain to ensure comfort and provide pain medication if need be. Infections can become fatal in a matter of seconds, and nurses are the ones that monitor the level of infection and give the right amount of antibiotic, antiviral, or infection-fighting medication, also at the right time and at the right dose. Second, nurses closely monitor patients. Nurses take vital signs and are the first to notice and report if a patient's status is improving or deteriorating. Because nurses spend so much time with patients, they are able to notice any slight change in behavior that can be life-threatening or that may not appear in the vital signs itself. If a patient becomes a threat to themselves, such as trying to remove medical equipment that is attached to their body, nurses will sit with this patient 24/7 to ensure that the patient is oriented and begins to understand what is going on. Nurses also watch how patients respond to medications, tests, or procedures and ensure that no adverse reactions occur, and are the first to respond if there is an adverse reaction. Thirdly, nurses are the patient's strongest advocate. Nurses talk with patients and grow to learn their values and traditions and how to respect them. Nurses help patients make informed professional decisions on care and whether or not they choose to receive a certain procedure. Ensuring a patient's safety is high priority, and nurses make sure all patients are in the proper environment for their certain condition. Now that I have discussed nursing itself, I will now discuss the daily routine of a nurse on a regular basis. A nurse's daily routine is based entirely on the patient's needs. Without nurses, special patients would not be able to maintain proper nutrition. This means basically that nurses help feed patients breakfast, lunch, and dinner when they cannot do it themselves. Nurses also monitor patients that are on tube feedings and ensure that the patient is tolerating the feeding properly. This basically means that the patient cannot eat anything by mouth, and a tube feeding is connected directly into their stomach. Nurses ensure patients are properly hydrated by providing them with water and monitoring the total output. This is important because patients can have fluid overload if they're not properly urinating, and this can lead to very serious issues. Secondly, nurses carry out and follow through with all orders. If a patient is requiring a radiological scan, the nurse gets the patient ready and ensures that they get to their destination properly. Physicians will write orders for patients such as inserting a Foley, performing an enema, numerous medications, or even taking laboratory testing. It is the nurse's job to carry out these orders in the proper manner. Other specialized clinics will often recommend orders for specific patient care, tests, or procedures in which nurses will then coordinate with them in order to complete this task. On rare occasions, nurses can refuse an order based on evidence or if a standard of care proves it will do more harm than good for a patient. Nurses perform different types of patient assessments throughout the day. Registered nurses perform admission assessments that establish the patient's need for diagnostics and medical care. Nurses perform physical assessments daily in order to see if a patient's condition is improving or to find any new developments. Specialized assessments can be done as well, such as a neurological assessment in which the nurse determines whether the nervous system is impaired or not. Nurses also do the dirty work. Nurses clean patients who have had bowel movements and are not able to clean themselves. Nurses also get rid of bodily fluids that have basically created a mess, and they keep patient environments clean and safe. Nurses also ensure proper collection of human waste, as oftentimes the characteristics of the waste itself indicates hidden issues that can be life-threatening to the patient. Now that I have discussed what nurses do on a daily basis, I will discuss why nurses are so important. Nurses are important and a vital part of the medical community because they are the patient's advocate and they spend most of the time providing direct care. Patient advocacy covers any aspect that is done for the benefit of the patient. I covered lightly on this topic earlier, but I'm going to go more in depth now. Nurses communicate with the families in providing updates and even consoling family members who may be grieving certain situations. Nurses are the first to discover and arrive to a patient code, which means nurses are the first to perform CPR and any other life-saving measures for a patient whose heart has stopped. The connection between the physician and the patient is the nurse, and nurses are the first to answer the patient's complaints or inquiries for the doctor. Direct care is individualized care provided by nurses, and it caters to the patient's specific needs and desires. It is shown that during a patient's hospital stay, 80% of the time spent is with the nurses, and it allows the nurses to ensure that they can learn everything about the patient. Oftentimes, patients are anxious to tell doctors certain details, or they do not get the chance to in the small window that the doctor is in the room. Nurses often learn and find these hidden details and can report them back to the doctor. Nurses help as needed with activities of daily living, such as walking, bathing, or even getting out of bed. Nurses adjust their schedule to help patients with even the smallest needs, such as lowering blinds or even fixing a pillow. Lastly, nurses assist in every aspect of the medical community and process. Nurses can specialize in many areas in clinics, such as being flight nurses, surgical nurses, military nurses such as myself, or labor and delivery nurses, and so much more. Nurses learn a little about everything and can help in surgical processes, insurance processes, or recommending care to physicians and other aspects of the medical process. Nurses double as teachers because they can teach patients and their families about a new diagnosis, how to care for this condition, the medication that they're receiving, and even basic nutrition care. Nurses are often referred to as the backbone of the healthcare system because of their amassed knowledge, experience, skills, empathy, and commitment. Nurses are often referred to as the backbone of healthcare because of their amassed knowledge, experience, skills, empathy, and commitment, and these are the sole basis of patient care. In conclusion, I want to review what I have discussed today. I first discussed nursing itself. Second, I discussed what nurses do on a daily basis. Finally, I discussed why nursing is important and why it is a vital role of the medical community. From patient advocacy to skilled individualized care, there are many reasons why nursing remains to be the most trusted profession every year. In conclusion, remember, Nightingale revolutionized healthcare and the way nurses are viewed in the public eye as trusted professionals. Nurses defend and advocate for the patient's rights. Nurses are a vital part of the medical community because they provide the most direct individual care to patients in need. Thank you.